I'd like to introduce Shawn Frasier of Pinnacle Health Informatics, who will be sharing some of our latest development.
Thank you very much, Ginger. So in our last meeting, we talked about some of the metrics that we are developing visualizations for. Is kind of it's a little more generic. We call it our Matterhorn project, and we're going to develop visualizations based on a data set that you see here. These are metrics that we've developed that are just kind of general, and then we're developing a set of dashboards to go along with these metrics. And I just wanted to show some of the progress. It's early on in the development of the visuals, but I did want to kind of give a little bit of an update and show a little bit about some of the things we're trying to track. So the first one on our list is time to note entry. And we talked a little bit last time about that and why that's important. And we want to track how long it's taking providers to get their notes in, and so that the billing process can continue. So with that, let's jump right in, and I will show a couple of these here. So here's one, and we're trying to kind of get the data, into a format that we're going to eventually kind of bring it all together in a single dashboard. But right now we're kind of breaking the visuals out to kind of get them the way we want them, and make sure that we're looking at the right data. This is, top 10 providers by average time to note entry. We have our top 10, our bottom 10, our top 10 programs, and our bottom 10 programs, just so we kind of get a feel for the range of data, and then drill into that data and take a look more closely at that. Another one that we're looking at here is, let me move this over to this other screen. All righty. Is we want to kind of compare based on what we call our rules engine. We have a rules engine that we use. Let me show this here. And here's a picture. Let me show my screen. It'll appear here in just a second. So here's an example of using our rules engine and looking at variance through a bullet chart. So you could list all of your providers by program or however, and then we compare them. We can compare based on a rule that we've set. And I think the rule that we have in our system right now is 5 days. Or actually it's 1 day. It's 1 day for this one. You can see how the various providers compare. The crossing item there is the goal, and you can see as an agency we're exceeding the threshold. And I think we'll probably make this turn red if it's exceeding the threshold here, and green if it's below. But you can see this first provider's right at the 1 day mark. The second provider is just a little over, and the third provider is way over on their average time to note entry. So any thoughts or comments about those?
I was thinking it might be good to mention, Shawn, that some of our ideas for this came out of that presentation that John Goman did, where we were talking about like how to know kind of how to monitor your agency's health. And that one of the points he made that kind of inspired some of this was that if people are really behind on their documentation and stuff, you don't really know where you stand as an agency. So I was just thinking that might be a good thing to mention.
Oh, excellent. Yeah, excellent. And these bullet charts make a nice way to do comparative listings, either by program or however. And like I said, we're going to change up the colors a little bit to see how, so that those are a little more visual, to see how those stack up. So any questions or comments about that? Okay, let's look at some other ones here. Okay, let's see. One interesting way to look at the data that we're going to that we're exploring is to kind of break it out by quantiles, right? Or quartiles, and look at our 50th percentile. Let's do a longer date range here. Let's run this one for a little bit longer. time. That'll give us a little bit better idea, and we'll see kind of the variance in time to note entry over time. I'll let that one run for a second. Let's see some of these other ones. So here's, while that's running, we'll look at something that's a time to note entry trend over time, so you can start to see, how's our average looking over time by agency, by provider, and by program. And you can see that there's been a little fluctuation, but for the most part, things are getting better, at least in this data set. We can start to compare those. Okay, here's our quartiles here, and you can see the variance here. So there's a lot of variance. We do have some notes that were entered way late. It looks like 74 days, 46 days, 26 days. That's our high watermark, and you see that's getting better too, right? So as time goes by, those outliers are getting closer, and then we can see here that the blue bar down here represents our 50 percentile, our 50th percentile group. And so we can kind of see that our 50th percentile is actually pretty small. So 50% of our time to note entry values are really quite low, and kind of stand about average. We need to bring these outliers down, and so we can see a little bit more detail. In this second one by provider, you can kind of see that a little bit better. There's our median as our darker line there. You can kind of see that the variance by provider is also coming down a little bit. And then by program, we can see that the programs are also seeing a decline in time to note. So that's good. That's a good thing to see in those. So I do like looking at things over time and looking at variance, so we get a better feel for how things are improving. And the hope is these will all come together and kind of at a glance, we'll be able to see a much clearer picture of how things are working as far as this metric. And this is just the first one. The next one is time to claim, and we'll have all these same dashboards, and then like the list, like the list that I showed, all of those metrics, we'll be doing a set of dashboards for them. And like I said, refining them, bringing them together, working with some different formats. I want to build some of these in Power BI as well. But this is just kind of the early proof of concept of some of these metrics. Any questions or comments about that?
I was thinking, Shawn, I know we've talked about these sort of box and whisker charts before, and kind of how median is different than average. Would it be good to just kind of touch on that maybe for folks that maybe didn't see our previous conversations about that?
Yeah, so this one here, I think I have a better one that shows median. Let me see if I can find that one really quick.
Or just how percentiles work, because that's, we were just talking about, some of us maybe didn't, it's been a while since we took statistics and all that, so.
Yeah, let me look up a better one here. Stand by just a moment here. Let's see. I have another one I can look at here. So your quartiles, we're trying to break everything up and kind of trying to look at the data in a way that sort of gives us a sense of how the distribution works. This is a good one here. So this is a longer date range, and we have our high whisker, and that's our absolute maximum. And so for October, we have 100 days, right? And that's a way, and we can tell because it's an outlier, because our 50th percentile block right here is down a ways on that scale. And so the top of our block is our 75th percentile. The bottom is our 25th percentile, and then our bottom line is our absolute minimum. So our minimum was 0 on for this month, for example, and our solid line here is our median, and then our dotted line is the mean. And so the difference between median and the mean is the median is the average. If I misstate that, somebody correct me. And the mean is the one with 50% above and below, or is it the opposite?
I think it's the opposite. Yeah. The median is the one where if you divided the whole population in half, that's where half the population would be below that line and half the population would be above that line. And then like for the 25th, it's like a quarter. So like the middle range, it kind of helps you find like the middle range of your data, sort of, right, Shawn? Like
right, and that would be
25th
this
to 75th.
Yeah, and the average is the top solid line, and you can see it's skewed by those outliers.
Oh, I
And
see.
so,
Got it.
and the dotted line then is our median, and it's actually not skewed, and so you can kind of tell that we have a lot of people that are below that, right? We have a lot of results that are actually very low because our median is low. Anyway, this just gives us a nice breakout of the data. You know, you can kind of profile your data a little bit. And you can kind of see they've had some big variance, and it's getting better over here in June. You can see that we don't have quite as a wide variance in the data. And it's a great tool that you can kind of look at the data and drill into it and find out where those outliers are and why they occurred. And even when we were building this chart, you know, we looked into some of the outliers, and just some of them were notes that hadn't been recorded for a long time. So it's very interesting. Any other comments, Ginger or Gary or anybody from the group?
No, I think it looks great, Shawn.
Yeah, no, that's really interesting. And I think being able to see the distribution, I mean, I think this illustrates why sometimes when people ask for the average and they get an average, like for example, if you look at that chart for 4/1/20 and you said, well, what's the average for for April? The number you would tell people would be that square, that line, the solid line, but most of the people are like way below that. So the average is being kind of skewed based on that outlier stuff. So that's why median can be such a more powerful way of looking at your data, I think, because we tend to have outliers in behavioral health, right? Like someone was on FMLA and they come back to work and catch up on their notes, or in some electronic health records, if you need to void a service for some kind of billing reason, you have to re-enter it, and that pushes out your dates. So I think that's why we're thinking about that. So, all right.
Excellent. Thank you. Any other comments from the group? Okay.
Do you find that these reports are more commonly just used by supervisors or administrators, or are these being given, is the access given directly to the staff so that they can see their stats?
You know, both. Reports like this one's probably maybe a little more than I mean, for a provider it might not make as much sense, but we have a lot of supervisors that do look at these variance reports and you know, are closely monitoring things. One scenario that we have used these extensively is kind of, you know, time from contact to first service to this, you know, to a follow-up service, and tracking all those things and making sure that the trend and the variance is reducing over time. And we have a couple agencies that have used those very effectively to reduce that and to make that, we call it client engagement in those situations, and make sure that the engagement is happening on a regular basis. Like this report here, let me move this over here if you can see that. This is the one I showed earlier. We do have a lot that the providers, we run by hierarchy or by team, and so the providers can see themselves and their direct reports, and people can see other people on their team and things like that. And those tend to be popular. So it just depends. It depends on the application. Some are distributed right down at the user level, and some are more supervisory. Thanks, John, for that question. Any other questions or comments? Okay, so that's kind of the extent of those. Like I said, we'll have more, and we'll be showing you more of these for the different metrics. They should be coming out shortly, and we can talk more about them at a future user group.
Hey, Shawn, this is Bob Hodson. Sorry, I couldn't get myself unmuted quickly enough.
Hey.
Have you thought about, like on the chart you're showing there, using a drill down to show like a distribution of the, the days.
Absolutely. We have done some of that. I don't have anything to show right now, but you could absolutely do that. Yep, drill down to more and more detail.
Because that would be a great way to show that, that 100 days was a single outlier or something like that.
Yeah, yep. That's an excellent idea. Kind of get a feel for how many outliers we have.
Yeah.
There's not many because it's in that, but it could be that 25th, that top 25th percentile.
Yeah, that's true. Yeah, we could get more percentile too.
But there won't be many. But that's a great idea. Well, good. Okay. Well, we wanted to shift gears a little bit too, and show another interesting data project that we're working on that kind of dovetails with this a little bit. We have several different projects that we want to sort of bring together into our Matterhorn project. This is one that's a little bit, some people don't use this tool, and so it may not be applicable to a lot of our clients, but a lot of our clients do use this tool. So we wanted to show a little bit of a different tool and talk about how we may be using that. I'm going to turn the time over to Gary. How does that sound, Gary?
Thank you, Shawn. Thank you. Let me share my screen here and move this because it's over the top of my screen. Okay. Yeah, the tool Shawn is referring to is the DLA-20. It's very popular nationwide. And let me just collapse this. And so we created a project here this last week, and we're very early in the build out of this. And even just preparing for this, I've found a dozen things that I need to add to it. But we have the basic build out here. The DLA-20 is an outcomes measure that it has 20 domains across it, and we can talk about some of those just a little bit. The cube itself, this is built off of a data mart that is in the system that is available for very close-in work with SQL to do heavy lifting and whatnot. But we also built a cube off of that, and this is the result of it. There are two measure groups. There's a client distinct count, which is always handy, and then the DLA-20 measure group. And as you can see, this contains all of the domains of the DLA, as well as a few extras that we've added, the average delta per day, the average delta per service, and that's a change in score from the first DLA that was given. So we can monitor whether a client's going up or going down. And then the score for each of the various domains comes down this side. There are 5 dimensions, so it's a pure star schema. The assessment date, and you can look at it by various values of the assessment date. You can bring in the agency if you are a multi-agency system, say within using Profiler. You can filter it by agency if you need to. Client dimension. We're bringing in the client full name, the ID, the gender, date of birth, and the age. And then the DLA-20, that just gives some of the basic stuff about the DLA-20, the severity index version of it, the effective date of that client assessment, and then the provider dimension, so we can look at this by provider and look at that way. I've just created a very simple crosstab report here that actually demonstrates one of the it's not, I don't want to say it's a downside, but we haven't included yet calculations for averages. And so when you see this DLA score, it's a sum of all the scores rather than an average of the scores. I've broken this out by gender, so I didn't show any PHI. I didn't want to bring in client ID. And then this number is the number of DLAs that the client has received. And so if we want to look at, so this client, there's one client in the system, it looks like that's received 9 of the DLA 20s, and these can be just followed over time. And once some averages are in place, we'll be able to do charting where we can look at a client by each of the DLAs that were given. And so we're looking forward to getting that out as soon as possible as well. But again, very early in the process, and if you're using the DLA 20 or thinking about using the DLA 20, let us know, and we'll get this up on your system as it evolves. All right, well, thank you guys.